Hi, I'm Dr. Melissa Androsov, a licensed naturopathic doctor and functional medicine practitioner. And today I want to talk to you about antacids, one of the most commonly prescribed medications in the United States and one of the most misunderstood and overused medications. Now, I want to first start with diving into the heartburn myth. So let's start with a very common story that I see all the time in my own practice. A patient has burning pain in their chest, heartburn or acid reflux. They go to their doctor, and their doctor says, "Oh, you just have too much stomach acid." And just like that, they're prescribed an antacid such as omeprazole, which actually is something you can get over the counter as well. Other common antacids and acid blocking medications that you might be familiar with are things like Nexium, Prilosec, Pepcid, and actually Pepcid is one that actually works slightly differently, but it is still part of this acid suppressing category. Now, what is the real problem here? These drugs are called proton pump inhibitors, or PPIs. And so, what they do is they shut down the proton pumps in your stomach that produce hydrochloric acid, which is your stomach acid. Now, here's the problem: we need stomach acid. So, we don't want to be shutting down these pumps. Hydrochloric acid is essential for killing harmful pathogens that enter the body through food and drink. It helps us break down our proteins. It helps us absorb key nutrients like zinc, B12, iron, magnesium, and calcium. And it's responsible for sending the signal to the lower esophageal sphincter to actually close, which prevents reflux. Stomach acid also tells the pancreas to release digestive enzymes to help us further break down our food. And it helps stimulate bile flow from the gallbladder to help us digest our fats. Right? So stomach acid is very, very necessary for our body's overall health. So when you suppress stomach acid, digestion doesn't just slow down, but it actually completely breaks down. So is it really too much acid, like we're always told by doctors when we have a symptom like heartburn or reflux? Here's the twist. Most people do not actually have too much acid. They instead have too little stomach acid. Now, low stomach acid means that the food sits in your stomach longer, it ferments, it creates pressure, and then this pressure is going to push up into the esophagus, causing these reflux symptoms. But the root cause was never excess acid, it was inadequate digestion. And guess what? Low acid doesn't send the signal to that sphincter, which means that the little acid that you do have can actually creep back up and cause burning. So, what do we do about this? Well, in my practice, we actually work on retraining the stomach to make acid again. So, sometimes we use supplemental hydrochloric acid in the form of what's called betaine HCl, and this is often paired with digestive enzymes, and this can work really, really well. But we really address the root cause, and we actually work on restoring digestion. Now, to be very clear, there are times when acid suppressing medications are medically necessary, like in the case of a gastric ulcer, right, where there is true acid damage to the stomach lining. And this can often be caused by an H. pylori infection, which is a spiral shaped bacteria that kind of sneaks past all of the stomach's defenses, often through things like contaminated food, water, or even just close contact. And then once it's inside, it buries into the lining and it totally disrupts acid production in a way that can lead to those ulcers. But even in these cases, treatment should be very short term and it should be targeted. PPIs were never ever intended to be used longer than 6 weeks. However, what do we see? We see this very commonly, that patients are on these medications for years or sometimes even decades. And the issue is that the consequences of being on these long term are very, very serious. So nutrient deficiencies, especially things like B12, magnesium, and iron, there's an increased risk of osteoporosis and fractures, gut dysbiosis, right, an imbalance in the gut microbiome. We see overgrowth and harmful bacteria as well as yeast like candida. There's an increased risk for food sensitivities because, right, that food is not properly digested. And then we see higher rates of infections like C. diff and pneumonia. So these are not side effects that we should be taking lightly. Now, here's another thing that I hear all the time that I want to address. So, a patient tries to stop their antacid, and then I felt absolutely terrible. I had to go right back on it. And there is a reason for this, and that is because of something called rebound acid hypersecretion. So, your body has been trying to produce acid this entire time, but it was blocked. Now, once the medication is removed, there's a surge of acid production, and it can feel very, very terrible. So, you have to make sure you're weaning off of these medications slowly and you're supporting digestion as you go. Now, in my practice, gut health is one of the biggest areas that I work with because it affects absolutely everything: digestion, our mood, our energy, our hormones, and our skin, right? We see a huge link between skin health and digestion. So I always like to start off with comprehensive stool testing to really uncover the whole story. This gives us insight into beneficial versus harmful bacteria, the presence of parasites or yeast, inflammation, immune markers. We can see short chain fatty acid production. We get to see how well you're actually breaking down fats and proteins and carbs. We look into secretory IgA levels to look really at the immune system because we know that a majority of our immune system actually resides in the gut. And then once we know what's going on, we can create a very custom tailored protocol that might include things like antimicrobials, digestive support, lifestyle changes, and it's very designed to your body specifically. So if you are dealing with burning, bloating, or any kind of gut discomfort, do not settle for a Band-Aid medication. Antacids are not the answer. They can be a useful short-term tool in those instances that I mentioned, but they are not a solution for chronic issues. You deserve somebody who's going to dig deeper, run the right tests, and work with you one-on-one to truly heal your gut and to restore your health. Thank you for watching, and if any of this resonates with you or you want to dig deeper into your own gut health, head to restorewellnesscda.com, or you can click the link in my bio to book a visit with me anytime. Let's start getting to the root cause of your healing and fix things from the inside out.